I think it's in recognition of the unique power that patient involvement as a construct can have on both provider satisfaction, patient satisfaction, and more globally in improving clinical outcomes. There's a unique power to bringing a patient's perspective to the table, and it's more than just involving the patient in care. While it does involve the intimacy of care, it also extends well beyond that to all policies and procedures across an institution. To bring that perspective to the care process from beginning to middle to end really has a profound impact on both satisfaction and quality. How has the One Voice process improved my clinical practice? We did a trial that was a patient and provider-directed trial last year looking at bedside rounds. And in general, the typical construct used in cardiology and in most adult inpatient practices involved the care providers gathering in a room, similar to this room, discussing a patient's care and then presenting their recommendations to the patient's bedside. The simple transition we tried to foster was moving the entire process to the bedside. And by doing so, we involved the patient more intimately at all levels. And the two most important examples that I can share with you are, one, it really decreased medical errors. And the way it did that is by letting the family members correct us, because we're not always right. There are assumptions we make regarding a care process or medication or compliance that doesn't always reflect reality. And having the family there to speak up on behalf of the patient helped us significantly. The second is when we approach end-of-life issues. Part of my practice involves heart failure patients, which are an advanced and critically ill group. And end-of-life issues is an important part of that practice. Giving someone the honor of a good and honorable death is important for all of us. But there was a patient in particular who was approaching end of life, who broached the issue with me before I had the opportunity to do so, because he had been well aware of the data on a daily basis and understood clearly what we were discussing. And for me, that's a powerfully intimate example of how a one-voice intervention improved my care process to a significant extent. Yeah, if I were talking to someone who asked why I should consider joining One Voice, I could tell you that there are a variety of reasons to do so, and I would reflect the patients who are currently involved. There are a group who feel the power and need to give back, who are very satisfied and happy with the care they've received, and view this as a gift not only to the institution, but to future patients. But I think the more important reason to be involved is the reason I'm involved. I live here. I receive care here. Our patients receive care here. And we all want to ensure, both as provider and patient, that the care is the best care it can possibly be. And truly, by being involved as a patient advocate in both policy and procedure development at this level has a unique opportunity to improve the care process to a significant extent. And in my mind, that's the most powerful reason for becoming involved in One Voice.